Which of the following is not a DSM-4 TR criteria for conduct disorder? A, has engaged in identity theft or computer-based theft or security violations, for example, hacking. B, has deliberately engaged in fire setting. C, has broken into someone's house, building, or car. D, often initiates physical fights. Yep, and the correct answer is A. And I kind of put this question together to also show you the limitations of working with a book that came out in 15 years ago. So, which of the following neurotransmitters are not well regulated in attention deficit hyperactivity disorder? A, glutamate and GABA. B, glutamate and serotonin. C, dopamine and substance P. D, dopamine and norepinephrine. And that is the correct answer, D, dopamine and norepinephrine. Nothing to disclose. It's not like I did any pharma stuff last night in the evening. I'm going to really, this again is a review course. I'm sorry if things are going very quickly, but I really want to touch upon every topic, put in my 2 cents, and then all the materials that you'll have to review later for a more thorough review. So to begin, we're going to go over, as you can see, these are huge amounts of subject areas, each with its own controversy, especially in child psychiatry. I'm going to touch on all these types of things to give you a sense of where the field is at currently. So we're going to review ADHD and oppositional defiant disorder, mood disorders, anxiety disorders, psychotic disorders, mental retardation and pervasive developmental disorders, and a brief review of substance use disorders and review elimination disorders, which is enuresis and encopresis. This is the diagnosis, actually should say on the top, attention deficit hyperactivity disorder. As you can see, these are things that you should be at least fairly familiar with at one point. In attention, one of the things careless mistakes is one of my personal favorites. It's very difficult for children and adolescents, especially the younger the child, to identify attentional problems. Mostly what they identify is possibly redirection in the classroom. So careless mistakes is one that I ask, would you know this? And then you look at the paper that you completed and see, wait, I knew that, why did I get that wrong? So again, pairing poor attention to your schoolwork. Difficulty sustaining attention in various activities, play activities, doesn't listen, no follow-through, avoids, dislikes tasks requiring sustained mental effort. So, I mean, this has to be fairly severe. I mean, a lot of kids would prefer to be outside than doing homework, but I mean where it's a big struggle. Can't organize, lose important items. And this is most of the time, by the way. I mean, all these things are most of the time, because you can imagine children are still developing, like we talked about in the development course, in terms of their actual brain and myelination and so forth. So these things will continue to improve in every child. Forgetful in daily activities, symptoms of hyperactivity, impulsivity include squirms and fidgets, can't stay seated, runs, climbs excessively, can't play, work quietly, on the go, driven by motor. An interesting statement, pretty disputed, whether that's really necessary. Talks excessively, blurts out answers, can't wait turn, and intrudes, interrupts others. So 6 out of the 9 core symptoms for 6 months. Remember the age criteria on this one, starting before age 7, and causing significant impairment at home, at school, or in peer relations. For the diagnosis, you want the family history, developmental signs, physical observation in the office. However, that child can, unless it's severe, maintain attention, or in fact some patients with ADHD can hyperfocus for periods of time. You want to get information from a naturalistic environment, so parent and school checklists is what we use at our clinic. A psychoeducational battery, if there's any concerns about learning disorders, and we'll go into that a little bit more, and then a school meeting. Differential diagnosis, I highlighted 2 of the common ones and somewhat commonly missed ones. The 2 that I highlighted is sleep disorders, children with poor sleep, for whatever reason, and then it could include, of course, post-traumatic stress disorder, will have difficulty sustaining attention. I mean, this is from a catecholamine basis. Produce catecholamines while you sleep and kind of recharge, and so if you're not sleeping well, your attention, we all know this, starts to fail the following day. Post-traumatic stress disorder, another kind of hidden disorder at times, especially in lower socioeconomic status settings, history of a lot of chaos and trauma in the household. Post-traumatic stress disorder, child can appear hyperactive, impulsive, and you can completely miss the diagnosis up until you give them a stimulant, and then they get out of control because it's an anxiety disorder. And learning and language disabilities is, of course, another thing we need to keep in mind. Highly heritable environmental influence disorder of brain function, ADHD, affects school, home, and social functioning, all three spheres that we focus on in child psychiatry. Heritability of ADHD, this is just to give you an idea of how heritable it is. We even compared it to height. Well, I didn't. In the study, they compared it to height, and you could see that ADHD approximates height in terms of heritability. Epidemiology, between 3 and 8% of school-age children, prevalence in boys being 3-fold to 6-fold higher than girls. Estimated that between 20 and 70% of children will continue to be symptomatic as adults. The longstanding issue with the prevalence in boys versus girls is a concern about selection bias, basically in a classroom setting, which gender will come to the attention of a teacher. And obviously boys will come to the attention of a teacher more often because they're also more likely to have hyperactive impulsive type. And remember we talked about women having better frontal lobe functioning earlier on, and so again, they have more compensatory measures. I have seen actually females come back to me from college saying finally they hit their ceiling. They just don't have the executive functioning and the attentional to master that kind of a low structured setting. No test for ADHD. This is important to reiterate to parents, families, adults. For adult patients who are asking if they have it. Teacher-completed scale is very important. They're the most reliable reporters. I guess for adult patients that wouldn't be true because it would have to be retrospective by 20 years or so. But in terms of children, they really are. They're the ones who sit down day to day and actually see case control in front of their eyes in the classroom. The children that have ADHD compared to their norms, the normative peers. Psychological testing is not for ADHD specifically. Mostly, interestingly enough, it's the tester's observation. When they went from WISC 3 to WISC 4, they actually got rid of freedom of distractibility because everybody started hanging their hat on that as showing ADHD, then trying not to make a test be conclusive for ADHD. Continuous performance task, it's a computer attention demanding task, checks errors of omission, and that's one thing you could look at. Actigraph monitoring, wristwatch size movement detector, looks for hyperactivity, even fidgetiness, and they wear that 24 hours. Rating scales are very useful. Connors are commonly used in terms of just more widely used. We use the Achenbach, which is extremely widely used, but that looks at multiple disorders and tries to screen for multiple problems, not just ADHD. Vanderbilts are used a lot in pediatric settings. Etiology of ADHD, you guys got this one mostly right. Dysregulation of catecholamines, norepinephrine, and dopamine. Psychostimulants primarily work by increasing dopamine in the synaptic cleft. Therefore, it's susceptible to abuse because they have that rapid effect. Atomoxetine, tricyclic antidepressants, bupropion, alpha-2 agonists, clonidine, and guanfacine all mostly work through changing norepinephrine modulation. Therefore, they're not addictive. Dopamine surgeries are obviously highly addictive. Just witness the problems with crystal methamphetamine. So again, primarily affect catecholamines. Here's a dopamine reuptake pump and the postsynaptic dopamine receptor. And what happens, you decrease the reuptake, allow, same old story, we've seen it before, allow increased dopamine in the cleft, increased binding, and better attention. And here over here, methylphenidate, amphetamines. Here's atomoxetine, or Strattera, acts through norepinephrine reuptake inhibition, increases norepinephrine in the cleft, and again, then increased binding. Of course, there's a lot of other things that go on here. Dr. Gillespie yesterday alluded to them. Downregulation, secondary messenger systems, all that stuff. So it's obviously very complicated. And for atomoxetine in particular, dopamine is an immediate effect. Dopaminergic medications like methylphenidate and dextroamphetamine, those act quickly. Atomoxetine requires this downregulation of receptors, this change in modulation in norepinephrine, similar to an antidepressant. Therefore, it takes 3 to 4 weeks, maybe longer, for it to actually take effect. Comorbidity, opposition to defiant disorder, 35%. What I tell the medical students and the residents is what I was told, kind of a Yogi Berra kind of thing. Common things are common. So those things are, there you go, ODD. So we're going to go into treatment, behavioral treatments, pharmacological treatments. Combination shown to be most effective. Parent behavior strategies. Rewards are more effective than consequences. Studies have demonstrated this. Parents focus on consequences and feel like they're bribing their child when there's rewards. What I tell parents when they feel that way and say things like that is, when's the last time you went to work and said, I don't expect anybody to pay me positive attention, give me any money, or possibly give me a promotion. You work on rewards as well. You don't just show up there for the day. Rewards are very effective, obviously.